স্বাস্থ্যই সকল সুখের মূল। কিন্তু আমরা রিসেন্টলি দেখতেছি বা বেশ কয়েক বছর ধরে দেখতেছি সোমালিয়ার মানুষজন সমুদ্রে ভাসমান বিভিন্ন শিপকে অ্যাটাক করে, জিম্মি করে, মুক্তিপণ আদায় করে। তো এখন আমরা দেখব যে আসলে এই দেশের মানুষের স্বাস্থ্য ব্যবস্থা কেমন। আজকের টপিক হলো হেলথ কেয়ার ইন সোমালিয়া অ্যান্ড চাইল্ড ম্যারেজ ইন সোমালিয়া, অর্থাৎ সোমালিয়ার শিশু বিবাহ কেমন অবস্থায় আছে এবং স্বাস্থ্যসেবা কী অবস্থায় আছে। Until the collapse of the federal government in 1991, the organizational and administrative structure of Somali's healthcare sector was overseen by the Ministry of Health. Regional medical officials enjoyed some authority, but healthcare was largely centralized. The socialist government of former President of Somalia, Siad Barre, had put an end to private medical practice in 1972. Much of the national budget was devoted to military expenditure, leaving few resources for healthcare, among other services. Somalia's public healthcare system was largely destroyed during the ensuing civil war. As with other previously nationalized sectors, informal private providers have filled the vacuum and replaced the former government monopoly over healthcare, with access to facilities witnessing a significant increase. Many new healthcare centers, clinics, hospitals, and pharmacies have in the process been established through homegrown Somali initiatives. The cost of medical consultations and treatment in these facilities is low at 5.72 US dollars per visit in health centers, with a population coverage of 95% and 1.89 to 3.97 US dollars per outpatient visit and 7.83 to 13.95 US dollar per bed day in primary through tertiary hospitals. Comparing the 2005 to 2010 period with the half decade just prior to the outbreak of the conflict from 1985 to 1990, life expectancy actually increased from an average of 47 years for men and women to 48.2 years for men and 51 years for women. Similarly, the number of 1-year-olds fully immunized against measles rose from 30% in 1985 to 1990 to 40% in 2000 and 2005. And for tuberculosis, it grew nearly 20% from 31% to 50% over the same period. Here we can see a child getting immunized for polio vaccine of Somalia. The number of infants with low birth weight fell from 16 per 1000 to 0.3, a 15% drop in total over the same framework. Between 2005 and 2010, as compared to the 1985 to 1990 period, infant mortality per 1000 births also fell from 150 to 109.6. Significantly, maternal mortality per 100,000 births fell from 1,600 in the pre-war 1985 to 1990 half decade to 1,100 in the 2000 to 2005 period. The number of physicians per 100,000 people also rose from 3.4 to 4 over the same time frame, as did the percentage of the population with access to sanitation services, which increased from 18% to 26%. According to United Nations Population Fund data on the midwifery workforce, there is a total of 429 ward midwives, including nurse midwives, in Somalia, with a density of 1 midwife per 1,000 live births. 8 midwifery institutions presently exist in the country, 2 of which are private. Midwifery education programs on average last from 12 to 18 months and operate on a substantial sequential basis. The number of student admissions per total available student places is a maximum 100%, with 180 students enrolled as of 2009. Midwifery is regulated by the government and a license is required to practice professionally. A live registry is also in place to keep track of licensed midwives. In addition, midwives in the country are officially represented by a local midwives association with 350 registered members. According to a 2005 World Health Organization estimate, about 97.9% of Somalia's women and girls underwent female genital mutilation, a premarital custom mainly endemic to the Horn of Africa and parts of the Near East. Encouraged by women in the community, it is primarily intended to protect chastity, deter promiscuity, and offer protection from assault. By 2013, UNICEF, in conjunction with the Somali authorities, reported that the prevalence rate from 1 to 14-year-old girls in the autonomous northern Puntland and Somaliland regions had dropped to 25% following a social and religious awareness campaign. About 93% of Somali's male population is also reportedly circumcised. Somalia has one of the lowest HIV infection rates on the continent. This is attributed to the Muslim nature of Somali society and adherence of Somalis to Islamic morals. While the estimated HIV prevalence rate in Somalia in 1987, the first case report year, was 1% of adults, a 2012 report from UNAIDS says that since 2004, estimates from 0.7% to 1% have been assumed. Although healthcare is now largely concentrated in the private sector, the country's public healthcare system is in the process of being rebuilt and is overseen by the Ministry of Health. The member of health is Kamar Adon Ali. The autonomous Puntland region maintains its own Ministry of Health, as does the Somaliland region in northwestern Somalia. Some of the prominent healthcare facilities in the country are East Bardara Mothers and Children's Hospital, Abu Duwak Maternity and Children's Hospital, Edna Adan Maternity Hospital, and West Bardara Maternity Unit. So that's all simply about the healthcare situation and child marriage of Somalia. তো আমরা দেখলাম যে চাইল্ড ম্যারেজ এবং বিভিন্ন স্বাস্থ্যসেবায় সোমালিয়া আগের চেয়ে উন্নতির দিকে যাচ্ছে এবং আমরা আশা করি যে একসময় এই দেশের মানুষ জলদস্যুতা ছেড়ে they will come back to normal life. Thank you. Bye bye for listening to this.